Good morning, and welcome to our newest edition of United We Learn. Thanks for joining us. I'm John Kelker, president of Your United Way. At the center of United Way's work in the area of health is our community. After all, this is where all of our work begins. During our program, please ask questions using the chat option. We'll wrap up in 15 minutes and stay for a few extra minutes if there are any questions. If you're watching a recorded version of our program and have a question, please send them to feedback@uwcil.org. Joining me today to discuss United Way's work in the area of health is Katrina Hayes, our Director of Community Impact, Mitch Baker, the Impact Manager, Carol Harms, Executive Director of Senior Services of Central Illinois, and Stephanie DeVingman, Clinical Program Manager for Lutheran Child and Family Services of Illinois. Before we begin, on behalf of United Way of Central Illinois, our staff and our volunteers, we would like to take a moment of silence to recognize Don Hunt, one of our extraordinary Health Vision Council members who recently passed away from pancreatic cancer. Thank you. Don believed so fully in the power of community and saw great potential in our work here at United Way. He will be deeply missed and always remembered. And now I will turn it over to Katrina to get our program started.
Good morning, everyone, and thanks, John. Activate and inspire our community to get healthy and stay healthy. This is the vision that was cast by our Health Vision Council in 2015 to guide our work. And as visions do, this set out a monumental task for us. As you have heard us describe before, to become activated, one must go from the passenger seat to the driver's seat of their own health. When we as individuals are activated, we recognize our health as a priority. We know what we need to do to maintain and improve our health. We know how to take the needed steps and when to take them, and we actively work to maintain and improve our health in times of stress. Now, community level change in most cases takes a great deal of time to happen. However, any change that will happen is driven by individual success in creating a healthier and more activated life for oneself. But there are so many things that inevitably can stand in our way or our neighbor's way. We may lack health literacy or knowing how to read and understand what is being taught or provided. We may not know where to start because our health is not the only problem we face, such as housing insecurity or food insecurity. We may not have trust in the system that is trying to help us, whether it be from personal experience or stories from a parent or relative. Or we may lack adequate insurance coverage or not have enough money to pay for services. Whatever the case may be, including more, this is where the story of our health work begins. Attempting to have all of our community in the driver's seat of their care, trying to overcome many barriers that stand in the way. As John mentioned, we are joined today by two of our health partners, and these two programs represent the diversity of the priorities we fund under health, including ensuring individuals are supported, connected, and activated to lead healthy lives, and increasing access to needed mental health services. And now I have the pleasure of turning it over to Stephanie and Carol to tell you more about their programs and the work we do in partnership with them.
Thanks, Katrina. Hi, I'm Stephanie DeVingman, and I am the Clinical Program Manager for Lutheran Child and Family Services of Illinois. Through this role, I oversee many programs that improve the well-being of people across the state by protecting children, strengthening families, and building futures for those who have experienced trauma. And one of the greatest fortunes we have is partnering with this United Way. The counseling program that United Way supports gives access to needed mental health supports, such as counseling to change behaviors and emotions and to create mental health stability and improvement. We do this for individuals and families who have the inability to pay, lack insurance, and cannot fully cover their copays. While there are many barriers that individuals seeking mental health services face, the ability to pay is one of the #1 reasons someone will not seek help. By reducing and eliminating this barrier, we are able to serve more people.
Hi, everyone. My name is Carol Harms, and I am the Executive Director of Senior Services of Central Illinois. And while United Way supports 3 programs of ours, today I am here to talk about our Senior Transportation Program, as we like to call it, the Senior Health Connection Program, which provides transportation for seniors to access medical appointments and other services. The funding we receive from United Way does indeed support our senior transport program. And at face value, you may be asking, how does this relate to health? Over 60% of senior needs for transport relate to medical appointments. And so without helping to reduce the barrier of transportation, more than 400 vulnerable community members would lack access to critical services. However, this is more than just a transportation program, and the Health Vision Council helped us see that. One of the strategies funded within the Health at United Way deals with training and engagement of stakeholders or health champions. These individuals possess access to vulnerable populations like our seniors and are in positions of trust. Every time our drivers are providing rides to services, our seniors clients are talking to them about a variety of issues. Some of our drivers may have personal experiences with those issues, and others may be completely foreign to them. However, one thing for certain is that there is a high degree of trust, and the riders are very receptive to the drivers. And this is really where our relationship with United Way and the Health Vision Council is most visible. Before our partnership with United Way, drivers only received the mandated training required by state grants. However, now, because of our health partnership, not only are our drivers trained every month on senior sensitive issues such as macular degeneration or fraud, they also serve as the first line of support for our clients. Drivers now take notes about the conversations that they have with their clients, of course with consent, and our transportation coordinators are able to follow up with each senior and provide referrals for them. This has allowed us to not only connect the seniors to the services that they need for their protection against abuse, but it also helps us to help them improve their health. Many seniors have indicated that based on the chosen topics, they may have gotten screened for their first time, accessed health to manage their prescriptions correctly, and ultimately felt they were connected to their driver. This adaptation of an already existing program to deepen relationships we had with our seniors is so important. Currently, we are working to expand our training of all of our drivers to include trauma-informed care training offered to our team through SIU School of Medicine, as well as the Mental Health First Aid USA training. I have been involved with United Way personally in many capacities, and interestingly enough, actually served on the Health Vision Council before coming to Senior Services. The work we are engaged in with United Way is some of my favorite work because, you know, it is making a difference.
Carol, I agree. One of the greatest assets I find working with United Way, especially this United Way, is their use of data for continuous quality improvement. Through the implementation of the United Way Client Health Survey, we not only have been able to glean important patient perception data, which is critical for measuring health activation, but also have been able to improve our processes that have impacted multiple layers of our organization. Not that we were doing anything wrong, but as we identified gaps in data collection or as the results came in, we were happy to use that data to enhance our services and to provide additional support to staff. As we grow and evolve and respond to the data, United Way is there helping us to become better in order to create better outcomes with our clients. And that is the biggest priority to this United Way, ensuring that the client voices are heard through the programming and that they are being provided the necessary supports they need to be successful. This is not something that not all funders do, and we truly appreciate that when they say community, it is at the center of their work. They continue to show up in that way within each interaction we have with them.
Thanks, Stephanie and Carol. And this is really why I love this work. And you both definitely described some of the ways that we work to keep community at the center of what we do. However, this work is only successful because of partnerships. Our Health Vision Council members are amazing, and they're always seeking out new and innovative ways we could be working with partners in the community, not just for programmatic purposes, but in order to help strengthen collective efforts, which is what I get to talk about today. Now, because of our work and our partnerships in health, we were invited to participate in the Sangamon County Health Needs Assessment process. This process is completed every 3 years, and it's a joint effort between the Department of Public Health, Memorial Health Systems, and Hospital Sisters Health Systems. Since we're highlighting partnerships here, I need to recognize that this collaboration was really the one that changed the game for our community and even the state when they started working together back in 2014. And because this is a collaboration, capturing a broad swath of the community's voice is vital to this work. And as such, that's our call to action for you today. We hope you'll take the time to join in on one of the focus groups coming up that are listed on your screen. Share about what personally stands in your way when it comes to achieving your best health, or share your perspective about the needs of your community. Last but certainly not least, there's always that element of what you want to see, your wishes for better systems or programs in the community. Now is really your chance to have your voice count when it comes to these critical issues for our community, and we hope that you will find the time to participate. And with that, I think John is going to close this out.
Thank you, Stephanie, Carol, Katrina, and Mitch. I appreciate you joining our program this morning. And thank you to everyone for taking time to join us. We will be taking a break over the holidays, and our next United We Learn will be January 8th of 2021. I hope you will join us as we introduce a 21-week equity challenge hosted by our United Way and United Ways across Illinois, which will start on January 18th. This concludes today's program, and we'll keep the session open for a few minutes to address questions in chat. Any questions we don't get to in the next few minutes will be saved and addressed on our website. I want to thank you, wish you a happy Friday and a wonderful weekend and a happy holiday. And I know that I personally posted one question into chat. Katrina, can you help with that question?
Yep, absolutely. So as Carol and Stephanie mentioned, they are two of our programs that are supported under our health issue area, but we do have a third program that just isn't here with us this morning because, you know, sometimes it's hard to have everyone in the room. And that partner is SIU Center for Family Medicine. We do fund their Circle 211 program, which is a collaboration that actually takes a look at multiple community health worker initiatives and brings it together under one roof to help with creating efficiencies for clients and our services and data collection as well. So we can continue to really support our clients, their clients, and walk the walk and talk the talk to, again, create greater activation.
Thank you. Again, thank you everyone, and please enjoy a happy holiday.